I'm Josh Weil. I'm a registered nurse in Tennessee. I'm a regional overdose prevention specialist. There's 22 of us across the state. What we do is provide education, stigma, harm reduction, things like that, and supply Narcan. And to mainly aimed at a specific set of the population. But we will train anyone, and anyone that needs Narcan and can't get it otherwise, we will absolutely supply it to. We started the program in 2017. We have distributed over 170,000 units of naloxone, and we have had 17,000 overdose reversals reported to us just from the naloxone we've distributed. Now, about 1 out of 10 opioid overdoses is fatal. So if you look at those numbers, that's quite a lot of lives saved from this program. Then we believe the number's a lot higher. We don't get all the reports. And all of y'all, Jackie and Madeline, and you can unmute and just ask questions as we go if you want, since it's such a small group. And this is what we focus on is first responders, and this is mostly law enforcement. EMTs tend to already have their own supply. The police traditionally have not. So back in 2017, we started supplying the police with naloxone kits. So all the police, unless they just didn't want it, are supplied naloxone by us. And we actually did, because of stigma, had a couple of police departments around Memphis at first that said no. They said they don't have that problem. And about a year later, they were calling us, asking us to come out as the epidemic got worse. So individuals at high risk of overdose, their family or friends. If I actually trained and gave Narcan to a grandmother the other day who called in response to an ad, who found her granddaughter passed out in the bathroom. Said her granddaughter and grandson both are using opioids, and she needed some help. So we went and got her trained. And we try to do that more than anything else. We like direct contact with the high risk populations. We work with the syringe service programs. Everybody who gets clean syringes gets Narcan. And that is where we see the most reversals, actually. And of course, the most treatment referrals and people getting help also. And, in addition to that, we will train anyone. Agencies, organizations that provide treatment and recovery services or are in contact with high risk populations, particularly indigent populations. We focus on the nonprofit agencies, treatment centers, halfway houses, things like that. We want to get them trained and make sure they have Narcan on site that they can either hand out to someone who's leaving AMA or someone they suspect may have relapsed, or to use on property. We don't want them just to keep it on property in case someone overdoses in the bathroom. This is for people to take with them if they are high risk and they're leaving the facility, something like that. We had a lot, that's the highest risk group for overdose, is the group that has actually gotten into recovery, gone to detox, gone to jail. Their tolerance goes way back down really quickly. And if they relapse or use again, then they tend to have a fatal overdose. So we want to make sure that that population gets supplied with the naloxone. We primarily do this through trainings in order to, be an agency and have naloxone to where you can distribute it. You have to have been through the training and gotten your certification and signed an agreement with the state. And we have done 1,450 trainings and trained over 32,000 people since 2017. And this is what we focus on when we do our training. So we focus on harm reduction, and that's what we do, right? And there's a lot of misconceptions about harm reduction. And we're trying to prevent, these catastrophic events from happening. In the meantime, it's very difficult to come in contact with a person with substance use disorder when they're actually ready to get help. But because of harm reduction, because of things like the trainings and, we leave contact information and the syringe exchange programs, when people are ready to get help, they know where to go. So, the coalition I work with actually runs one of the syringe exchanges here in Shelby County, and we have done hundreds of treatment referrals. We've been running for a little bit over a year. And then we do stigma training. We talk about the person first language, and the misconceptions behind things like syringe exchange programs and Narcan programs, that people get the idea that we're enabling people or helping them to use drugs. And the truth behind that is someone that takes advantage of an SSP or is trained in Narcan use is about 5 times more likely to get help, to get treatment, and their use actually decreases. And to increase public awareness. So we talk about what's going on with the opioid crisis. We have the numbers, the high overdose areas, and we talk about the disease of addiction and the science behind addiction. And I think that relates very closely to stigma, because people do not understand what they're seeing when they're looking at substance use disorder. And it's often misconceived as a moral issue or an issue of weak willpower or just bad behavior, and without the understanding of what is driving that behavior. And after this, at 12, I'll be doing a Narcan training. So if any of you want to attend that, we'll talk about that for a little bit. So the ROPES, the Regional Overdose Prevention Specialists, were created in response to the opioid epidemic. These numbers are from 2019. So, in 2020, this had increased. I know we're down a little bit from last year, but the pandemic has, we've seen a big increase in the number of fatal overdoses since the shutdown and the stimulus checks and all the recovery meetings shutting down and harder to get into treatment. It was kind of the perfect storm for an increase in overdose deaths. But if you look at that number, more than 130 people in the United States die from an opioid overdose every day. So that's one person about every 11 minutes dying from an opioid overdose. So this is the number one cause of accidental death in the country. And it's the number one cause of the death of young people in the country right now. And in Tennessee, we see one death about every 5 to 6 hours. So, you can see the need for naloxone. The Surgeon General has recommended that everybody carry naloxone, have it in your first aid kit. And it's also being taught with CPR now. So basic CPR, they're teaching naloxone administration. So that's kind of how widespread this thing has become. That, the Surgeon General is recommending that naloxone be in your first aid kit, as if it were, Band-Aids or something like that. Because it's more likely now that you will come across an opioid overdose than it ever has been. So, and we were just talking about this, Wayne and I, this number had gone down so consistently from in 2017. We have 6,150,000 people in Tennessee. The opioid prescriptions in 2017 were higher than that. We had about enough opioids circulating to give 1.2 prescriptions to every man, woman, and child in Tennessee. 2018, I believe it was 6,050,000. And if you look here in 2019, 5,368,000. So that's 0.8 prescriptions for every man, woman, and child in the state. Still not great. And people do need these. Now, we're not trying to prevent people with chronic pain from getting their medication. The problem is when it's written at such a high rate, these prescriptions, we have about 10 to 20% of the population that's prone to become addicted to opioids. And with this amount of that medication out, and, addiction happens when repeated use goes on. And when people get their medication from a doctor, they're told to use it repeatedly in a lot of cases. So what we see is about 50% of opioid addictions have come from a prescription that someone got from a doctor. So in 2019, 1,543 Tennesseans died of an opioid overdose. It's 23 per 100,000. Go up in 2020. I'm not sure the numbers for the state. I know in Shelby County, where I am, we jumped from 319 to 420 in 2020. And we are already, as of 2 or 3 days ago, we were at 155 for the year. And, the reason we're seeing the increase is if you look at this information on the bottom, from 2015 to 19, heroin related overdoses increased by 85%. Fentanyl related overdoses increased by 500%. So therein lies the problem. And that doesn't mean we don't still have prescription overdoses. And, one of the first reversals we got reported was an elderly woman who had forgotten she'd taken her medication. She took it again and she overdosed. And her caretaker had gotten Narcan from us and used it on her, thank goodness. But what's driving the increase in fatalities is the fentanyl. And now fentanyl, there is pharmaceutical fentanyl they use in procedures like colonoscopies for sedation and things like that. This is not what this is. This stuff is being made in laboratories in China and Mexico illicitly and being shipped over here through the mail or coming up through the border. And it can be up to 50 times stronger than heroin. So it takes a very, very small amount to cause a fatal overdose. And the trend is, that the people's tolerance is becoming so high on the street that they're not looking for heroin anymore. They want fentanyl. That's what they're trying to get for themselves. But it really doesn't matter how high your tolerance is. If you get, was it you, Wayne, that said 4 grains of a pure fentanyl will overdose a person?
The dose the size of 4 grains of sand.
So imagine trying to mix
lethal
fentanyl.
dose.
If you're trying to mix fentanyl into cut and have, that small amount in each section of your package, it's almost impossible to do. They're not doing this in pharmacies or, factories. They're doing it. Drug dealers are the ones mixing this stuff. And not only that, but we're seeing a bunch of fake pills. This is a good point of education that, they're taking these pill presses and making pills that look like Xanax or Roxicet or Percocet or hydrocodone, and it's pressed fentanyl. They're not real. We just had 4 people die in Martin, Tennessee that thought they were taking pills, and they've gotten so good at it, you cannot tell the difference between them and a pharmaceutical pill. And it's so imagine someone thinking they're taking a Xanax, they have no tolerance to opioids. They don't take opioids. They think they're taking a Xanax, and the first opioid they take is 50 times more potent than heroin. So we have a problem there. And we've been seeing this more and more. And we've also been seeing fentanyl mixed into other illicit drugs like cocaine and crystal meth. And we're also seeing a big uptick in crystal meth use on the street. So the way that we do this is a federal grant provided by the Tennessee Department of Mental Health and Substance Abuse Services. So, my part in this is to collect data along with doing the trainings, and we do surveys after the trainings. We have to report the overdose reversal numbers and the naloxone distribution numbers to the state. And that way this program keeps on getting paid for. So we do work very closely with the Lifeline coordinator, and this is the guy in your area who will actually answer the red line phone if we get a call for Shelby County, somebody that needs treatment. They will refer them to, I believe, 3 treatment centers. If they can't get into one, then the phone will go to the Lifeline coordinator, and he works with us at our coalition. And this is the number that you call for the Tennessee Red Line, or you can text SAVE to 30678 for contact information in each region. But every region has a ropes. Every region has a person that does what I do, or 2 if they're big enough. Here in Shelby County, we have 2. And every region has a lifeline coordinator whose job is to connect people to treatment that suits them. So it could be medication assisted treatment, it could be a detox, and then long term, and we try to let that person decide what they think is best for them as well, and have them kind of be the arbiter of what their treatment's going to look like. And you tend to have a lot more success that way. So this is the map of Tennessee, and whatever county you live in is color coded, and that person under that color is the regional overdose prevention specialist for your area. So this is the way that you can contact us, and we can supply training, Narcan, referrals to treatment, anything you can think of that is recovery oriented. If you have a agency that you would like to be trained, or that you feel would benefit from receiving naloxone, or in the case of for-profit agencies, we can be referred to per client. So if one of your clients you feel needs Narcan and is unable to get it through insurance, or won't get it because of stigma or whatever reason, they can be referred to us, and we can make sure they get trained and have naloxone on them. And like I said, everyone who gets prescribed opioids, everyone who has substance use disorder should have it. Everyone should have it, really. But it's very important for family members of using persons, and the using persons themselves, and agencies that work directly with high-risk people have naloxone. So if you don't, and you're interested in seeing how you can get it, call the person that's in your area, and we can make arrangements for that. And that's all I got. Does anyone have any questions?
Yeah, Josh, I might add, I've been through the training. They actually have an online training that you can do. I did that first, and then I actually went to a presentation that Candace Beatty did. There was about 8 or 10 of us in that, and it takes less than an hour, and it's a good presentation, and they'll give you a card to carry in your wallet, because if you administer Narcan to a person who needs it and they still die, you are not held legally responsible for that.
Absolutely not.
Protected.
So, naloxone falls under the Good Samaritan law, which means it doesn't matter the outcome. If you're trained and you have any reason to believe that a person might be overdosing, you are protected. It's right in there with CPR. So whether they took opiates or not, whether they survive or not, it makes no difference. If you have a reason to believe that person might be overdosing, then you can give them Narcan with civil immunity. And, you don't have to know what they took, because in a lot of cases, you're not going to be able to ask them. Someone that's overdosing can't tell you what they took, and they don't always have a needle in their arm or their drugs out, right? So we're not always going to know. But I tell you, I worked as a nurse in the emergency room, and every single person that came in there unconscious got Narcan first thing. Doctor hit him with Narcan and Romazicone just to make sure they weren't overdosing on opioids or benzos. So, it's one of those things. It's better to use it and not need it, because it will not have any ill effect on that person. It will simply attach to their receptors and then come off in about an hour, and it won't do anything if they're not on opioids. If they are, that's, I like to say, the only side effect to Narcan is breathing.